I'm Bertha Coombs. Thanks for joining us for a bonus edition of the CNBC Global Evolve Summit. I'm joined by UnitedHealth Group CEO Andrew Witty. Thank you so much, Andrew, for joining us.
It's a pleasure. Great to see you.
So you are in the process of transforming UnitedHealth into a different kind of company. You've talked about wanting to make it more consumer friendly. We've heard about this a lot in healthcare. And yet, oftentimes, it seems what happens is you get new layers and new layers, things get more expensive, and consumers are still left in the middle feeling like, I'm just paying more and it's more complicated.
Right, so we are absolutely committed to trying to improve the consumer experience because we agree with what you've just said. I mean, I think the irony of the US healthcare system, all of this technology, incredible people working in this space, unbelievable passion. But what we've ended up with is a very fragmented experience for the consumer. So you need an app for this, or you have a doctor for that, all sorts of different elements, which in the end, the consumer is somehow you're trying to manage all of that. And of course, the more you fragment it, the more expensive it becomes. So what really Optum offers and is working toward building is trying to bring back a kind of whole person orientation. So let's think about this from the perspective of the individual, the patient, the consumer. How can we really get how can we really bring back together the best of innovation, the best of quality at the fairest cost, and get a simple end-to-end process in place? Now, this is a long journey. We've been at this for a while, but as you look at the organization, what you see is more and more progress of joining things together. So you think about value-based care. How can we help get in front of disease? How can we prevent? How can we keep you well rather than just be there when you're sick? We know that's economically good.
So paying more for that longevity as opposed to every time the doctor sees you,
Correct.
Fee for service.
Absolutely. So we'll take the risk to make sure that we get you the best care, right? That's what we're really trying to do there. We will take that risk because we think working with your physician and all of the other services we can wrap around, we can keep you out of that hospital for longer, we can keep you out of the ER, we can keep you at work. All of that is the model we're moving toward. Now, we know to do that, it's not just about having a great doctor. And I'm super proud of the 70,000 great doctors who are at Optum. It's not just about that. We have to be there with virtual because we know some people need virtual care. Some people just want a video consult. A lot of people can't even get into the clinic.
Right.
So as we're building up our home services, how do we get care into the home? How do we make sure those people are looked after properly? So the core to all of this is bringing things together, really thinking about it from the perspective of the patient, and then making sure we make it a seamless experience. And that's where things like our financial services operation come in. So how can we make the payment process easier? It's where we think about how to streamline connectivity between providers and payers. How can we make that easier? Because the doctors need a better system. It's driving doctors crazy engaging with this complexity. All of those are areas we believe we can improve, and we know we're making progress on this. And if you look at our investment strategy, you look at our NPS scores, you look at the satisfaction scores, you look at the number of people who are choosing Optum as their provider, all tell us that this is a pathway they want to follow.
In some ways, you've talked about building and sort of the front door to healthcare, which is something that a lot of folks use. Like Walgreens and CVS, but they actually have front doors. They have actual brick and mortar places where people can go. Your doctors have offices, you have some clinics, and you do have some pharmacies with the Genoa pharmacies in mental health. But overall, I don't think people think of UnitedHealth as a place they can go.
Right, and that again is changing very rapidly. And I'd say, on the physical side, 20 million people come through the front door of an Optum clinic, and about 3.5 million seniors who are under some kind of value-based care come through those doors. So a lot of engagement there. All up, about 100 million Americans are engaging with Optum Health every year in one form or another. There are very few companies in America that have a relationship with 100 million Americans, and none that have a relationship as intimate as healthcare. So that is an incredible connectivity. Now, so of course we're building that out, and even in the last quarter we've added 2 really important new clinic organizations, one up in Massachusetts, one in Texas, really to continue to extend that physical presence. But then what we're building, and we're making some very significant investment in, is very much that digital front door. I really want people to come to Opt. If they want a pack of Advil, if they want to figure out how to get that knee fixed, if they want to figure out how to price care, if they want to know who the best doctor is, who's most likely to use evidence-based medicine to look after them, if they want to come and find somewhere for the best value insurance, I want them to come to Optum.com. And we're building that. We're going to be building something which is a very different kind of marketplace presence from the digital side, which will complement the physical side. So
what will that look like?
It's going to look like a healthcare marketplace. It's going to look like a place which is welcoming to non-UnitedHealth Group companies. It will host, I will be thrilled to host competitors in that environment. I want to make an environment where the environment where people know if they want help, the place to go look first is Optum.com. And then we will make sure they get plugged into the right places. So we want to, we both know, I think, that the US consumer has changed habits over the last 20 years, thanks to obviously digital and mobile technology and the like.
And certainly over the last 2 years in terms of healthcare.
Even COVID has accelerated everything for healthcare. What healthcare has to do is catch up with the sophistication of the American consumer. American consumer, I believe, is going to be increasingly expecting to see in healthcare what they already experience in other sectors. The healthcare sector has not done that historically. We're going to change that. That's why when we talk about consumerization, we're not talking about just a little layer of varnish. We're talking about a fundamental change in the way in which we work with consumers, their families, work with patients in the journey to keep them well and get them better.
You know, one of the things, and I have ranted about this as a caregiver and as a patient, there is such frustration that it's very difficult to get all of your records in one place, and God forbid you have a really critical disease. You know, people sometimes have to go with notebooks to be able to, every time they see a provider, say, this is what's happening, this medication has changed. There's no central place. I have this fantasy that in single payer health systems, it's easier and there's one record, but in ours, there isn't. How can you help as you try to transform, bring that forward and in a way that's agnostic, so I don't just have to be with UnitedHealth?
Absolutely. Well, let me first of all just confirm one thing. You do have a fantasy. I grew up in a single payer environment. There is no single record in a single payer environment. It's just as annoying as it is here.
All right.
So I'm just going to, make sure you know that it is truly fantasy. What we're working toward is exactly what you've just described. So we've been developing over the last several years an individual health record, which looks to use all of our kind of machine learning capabilities, various really important kind of ontological algorithms, to bring together all of the information for a patient, but really in the view that it's a patient asset. It's not our asset, it belongs to the patient. The patient can take it anywhere they want. So the whole principle of all of this should be very much, it's your data, you should be in charge of it, and you should be free to take it where you want. I actually think the most important thing is to have something like that alongside a physician who is acting as a quarterback for you. So I think the key to all of it, because it's not just having the information, it's having the confidence to know where to go and not to be kind of confused and distracted by the system. And you know, for those of us who live and breathe in healthcare, I think we can really underestimate the scary complexity of this.
And how confusing it is for so many people.
And you know, for most people, it's tough to pronounce some of the words that the healthcare system use. I mean, it's just. And you know, honestly, why should everybody have to have a PhD in healthcare to use healthcare? It doesn't make any sense.
And even people with PhD, because I've talked to some, have run into some of the same issues.
Same problems, right? So we want to try and, so it's super important that yes, we have the aggregation of data. It's important that we build systems for physicians which give them that similar kind of visibility. So I actually think having that integrated information for the physician is there. And then I think having your quarterback physician, you look at Optum, what we're building are these physician groups who really are thinking about people holistically. They will go back for you to get you the best care at the right place. And I think over time, you're going to see a combination of certainly data, but new ways of identifying how care can be sourced in the marketplace on the day you need it, so that that physician is going to be in a position to say, okay, Bertha, today, we're going to need this for you. And right now, I'm going to suggest you go here for it because it's the best quality, they've got the best track record looking after folks like you, and it's a fair price. Now tomorrow, he might send you somewhere different. I want to create an environment which is super dynamic and responsive to the patient need. That's a data, technology, and physician as an ally. And I think that's where, and in a strange, I bet some people will listen to this, say, isn't this guy talking about the 1950s? And in a way I am. Because I think what we really have to do is bring that physician as an ally, and then give the physician the kind of reinforcements that 2020's technology can give them. That is going to be a very cool shift in the way in which healthcare can move forward. I think if we do that, the single payer countries will be looking and saying, we want that in our country.
You know, one of the things that we've talked a lot about in our country, and you've talked about in terms of changing the focus at UnitedHealth, is looking at how to bring people who are more marginalized, trying to address issues of equity and ESG, which has lately gotten a bad rap. A lot of people saying that it's really just about getting on the right index and trying to do publicity. What can you tell people as they think about ESG, how important that is, or ESG rather, in healthcare?
Well, so I think it's a critical issue in healthcare, and it really boils down to access, and whether that is access to insurance or access to care. You know, I personally, it's not right that people don't have that, and I don't think that is a deeply kind of ideological view. I just kind of almost think about it as a point of view. Just imagine if it was you. Just imagine if it was you and you needed that care and you just could not find your way into the system, either because the system was somehow biased against you or you didn't have the resources. And it's just by stroke of luck that we're in a position where we do have access versus that other person. And I've always, I've been in healthcare for my entire life or working life. And it's always been a driver for me of, if I'm lucky enough to be in a position of any kind of influence, you should use that influence to try and help the people who had the unlucky break at the beginning when you had the lucky break, right? So for me, this is it's a passion for me. And it's been true for me, in my previous life in areas like Africa and in developing world in a different way. How do you get HIV meds? How do we get vaccines available to folks in developing countries?
You took time out to work with the
time I
World Health
spent at
Organization.
WHO was very similar. How do we accelerate COVID treatments and vaccines for the developing world? In the case of the US, it's a completely different issue, of course. But what we're working on is how do we build capabilities? So, for example, our behavioral pharmacy practices like Genoa, they reach into and they look after people who are many of whom are really struggling to get into the system. They've had a tough draw, and they're in a tough place, and they need an ally, and that's what Genoa does. If you look at our UnitedHealthcare business, the lean into our Medicaid platform and the work. If you want to meet passionate people in United Health Group, meet the people who work in our Medicaid business. They are unbelievable. The passion, the commitment they have to look after folks. How we worry about making sure people don't lose coverage. So as we think about, there's always changes in the healthcare system, how we make sure people don't get dropped off that. And then we can look at areas where we can build for the future. So we recently announced a very significant step up in our investment in diverse scholar training. So how do we make sure that more physicians and nurses and clinicians come from and look like the communities that they look after? Because just at a very base level of empathy, that's a key element, right? Just making it possible so when people walk into the clinic, it's like, okay, I can kind of relax because it feels like home, right? And that kind of investment of workforce is so important. So this is an area we're going to relentlessly move on. The announcement we made just a few days ago in terms of zero copay, zero deductible for life-threatening drugs like insulin and inhaled albuterol for opioid overdose. These are really good, very specific examples where we are relentlessly looking for ways in which we can lean forward for people who are having a tough time. And that, for me, is what health equity is all about.
Andrew Witty, thank you so much for joining us, and we certainly want to stay in touch as these programs grow and see where they go.
Well, it'd be a pleasure, and thank you so much.